Good evening, Jade. There were
Good evening, Laurence. Thank you for having me.
My pleasure. There were 21.4 million people prescribed antidepressants in a 2-month period last year. Is that the answer to this mental health crisis that we seem to be going through?
It's a difficult one, and it's very much a case-by-case basis. Some people find that medication is really beneficial for them. Some people find that psychological therapy is also really beneficial. And some people actually find that both are really beneficial used together. So it is really a case-by-case basis in terms of whether medication is the answer.
Where do you begin when you meet a patient? Are you assessing everyone simply on a case-by-case basis, or is there a piece of advice you give someone after their first consultation with you that will help straight away? What's the best bit of advice you can give?
Again, it is very much case-by-case basis. It completely depends, what the client or patient is presenting with, and also what their goals for therapy are. Some people just want to understand themselves better and what they're going through, but some people also want to have some strategies or coping skills. So it really does depend, and also depends with if they're coming in with depression, if they're coming in with anxiety, if they're coming in with a personality disorder. It really depends. So it's hard to, I suppose, give a clear-cut answer, straight away. That's why we've got to have an initial session, and there's lots of conversations that go on prior to even seeing the client, for example.
Is, for example, I was saying yesterday, because I was feeling down at Christmas, that exercise really helped me. Is that sort of down in the book as something that would be useful as a first piece of advice for someone to go, get out there, get in the outdoors, breathe in some fresh air? That will help. Go for a walk.
Definitely. All those self-care things that you've just mentioned, exercise, getting outside, eating well, sleeping well, they're all things that are almost the first page in the textbook in terms of what will help to promote better well-being and better mental health. But obviously, we know that it's not as easy as that these days. There's a lot of, traumas that people have also gone through. So it's not always as easy as just prioritising self-care, but it's a great place to start.
And do you think there's anything to be said for, taking almost the opposite approach and becoming more stiff upper lips like they were in the olden days? Or do we benefit from exploring and examining trauma? Is there any benefit to stoicism?
Definitely. I mean, I'm a psychotherapist, so my perspective on it is that actually talking about it is the best medicine and the best remedy. So there's definitely, people have different views, but my view would be that actually if you bottle all that up and you have that stiff upper lip, that actually it's going to come out in other areas of your life that you might not notice. So it's like a pan almost bubbling over. You're going to notice it perhaps come out in your relationships, or you might notice it come out at work. So other areas of your life potentially that you might not think are impacted. You might start to notice that your irritability is slightly higher, or that your anxiety is really high. And actually sometimes when we unpick all that, and that's the work of therapy, we can then understand that actually maybe that boils down to a previous trauma you've experienced. So it's really important to explore that and talk about it to give clients and patients understandings.
Do you think that there is a link between, the emergence of smartphones, smart technology, fast living lives, the fact that you can communicate remotely with everybody and you can't really opt out and take a rest? Do you think that plays a big part in it as well?
Yeah, I think it really can do, because it's really difficult for us to switch off these days. We have so much access to a lot of information as well. We're getting notifications constantly of updates about what's going on in the world. We're getting notifications about what's going on with people in our lives. So it's really hard for us to actually switch off. And I suppose going back to yesterday's show, that's a part of being out in nature that can be really helpful, because it does allow you that time to actually switch off, particularly if you choose to maybe leave your phone at home. But I definitely think it plays an impact, because we've got much more access to things these days.
Well, thank you very much, Jade, for coming on and talking to me.